Hello, everyone. This is Dr. Karan from Dr. PK Life. Today, I wanted to discuss briefly about chronic fatigue syndrome, or other name is myalgic encephalomyelitis, ME or CFS. So, over the course of 30 years of my practice, I've seen a bunch of people are diagnosed with chronic fatigue syndrome, although there are lots of misdiagnoses as well. And that's why it's really important that diagnosis is made properly and other conditions which may mimic chronic fatigue syndrome be excluded. So, what is chronic fatigue syndrome? It's a chronic condition where people feel fatigue. It's characterized by persistent, unexplained fatigue lasting at least 6 months. And it's not relieved by rest and is often worsened by physical activity or exertion. So called post-exertional malaise. And it can be associated with brain fog, joint or muscle pain, headache, and unrefreshing sleep. And it is a diagnosis of exclusion. That means other causes which may mimic these symptoms got to be excluded. So, other causes, let's talk about other causes because that's what's most important. Those other causes which may mimic like CFS should be excluded. Iron deficiency. So there are cases where patient is not anemic, there is no anemia, but patient has iron deficiency, relative iron deficiency, and that can cause also CFS without having anemia. So it's important to check the iron level even in people with normal CBC test. Ferritin level should be checked because ferritin level is a storage form of iron, and a low ferritin level can indicate iron deficiency. Iron level itself can be normal, but even if the storage form is low, it can cause chronic fatigue syndrome like symptoms. Vitamin deficiency. So, vitamin B12 deficiency can cause fatigue and neurological symptoms and brain fog. Vitamin D, which is one of the common vitamin D deficiency these days, there's a common reason people feel tired and weak. Vitamin D is extremely important for normal metabolism of the body. So if somebody got chronic fatigue and muscle ache and weakness, vitamin D must be checked. Adrenal insufficiency called Addison's disease. There's a lack of adrenal hormone. It causes fatigue, weakness, low blood pressure, nausea, sometimes pigmentation of skin. So in that case, we check morning serum cortisol and ACTH level. ACTH is adrenocorticotropic trophic hormone. Other condition, post-viral syndrome or Epstein-Barr virus reactivation. Some individuals develop prolonged fatigue after viral infection like mono or COVID-19. So, and if you do the testing and it shows EBV antibodies, Epstein-Barr virus antibodies, that means there has been EB virus reactivation and it can cause CFS-like symptoms. And by the way, there's no treatment for EB virus infection. Autoimmune disorder. Lupus is number one, Sjogren syndrome. They can cause fatigue, and there are a bunch of tests, but the initial screening test is anti-nuclear antibody, and if that is positive, that leads to further test like anti-double-stranded DNA antibodies, anti-Smith protein antibody. So that has to be carried out by a primary care doctor. Mitochondrial dysfunction or metabolic disorder, although very rare, but some metabolic or mitochondrial condition can cause intermittent fatigue. Some people may also have something called coenzyme Q10 deficiency or inborn metabolic disorder, and that may also lead to this condition. Sleep related disorder. So some people have sleep disorder, they sleep a lot, it's called idiopathic hypersomnia or narcolepsy without cataplexy. They causes excessive daytime sleepiness. The sleep study should be done, or a special type of sleep study called multiple sleep latency test, MSLT, may be needed. Actually, there's a patient of mine right now. She's going through MSLT testing because she has a chronic fatigue. Cyclical Cushing syndrome. It's a very rare condition where the patient feels that there is an episode of fatigue which is usually related to excess cortisol level but followed by adrenal fatigue. So there is an excess amount of cortisol and then it's followed by adrenal fatigue that leads to cyclical fatigue. So in that situation, if you check 24-hour urine for cortisol level, when patients are having symptoms, then you can detect the lower level of cortisol, and that will help in coming to diagnosis. So next step is basically I do is check ferritin, vitamin B12, folic acid, vitamin D, morning cortisol, ANA, and Epstein-Barr virus panel, sometimes even CQ10, which for which you have to send a sample to a special laboratory. And you need to also take a help from other specialists like a neurologist and rheumatologist if it is needed. But what I do is I do all my workup first before I send my patient to a specialist, so that I've done my part, and specialist is also ready to come to some diagnosis during first visit. So if complete blood count is normal, ferritin level should be checked. It's RNA storage form protein. It should be more than 50 nanogram per ml. Serum iron, TIBC, transferrin, saturation, because they indicate the total iron in your body. B12 should be checked. Usually it should be more than 400 picogram per ml. And there's other test called MMA and homocysteine, methyl malonic acid and homocysteine. Their deficiency, their numbers can indicate if there is a B12 deficiency or not. Vitamin D, 25 hydroxy vitamin D should be checked. Optimal level is about 30 to 80 depending on the lab. It does vary from lab to lab though. So you need to go to check the reference number from the labs. Suppose if the thyroid tests are normal, and if you're thinking that patient might have adrenal function problem because the episode is recurrent, patient is having fatigue of extreme